There are so many details to Medicare that it can make for a lot of questions. This show is dedicated to answering those Medicare questions one by one and serving as your resource in the modern Medicare world. This is Medicare Made Simple with Kevin Geiger.
Welcome to Medicare Made Simple with Kevin Geiger of Carolina Medicare. I'm Mark Elliott, and we're certainly in a busy time right now for Carolina Medicare. Open enrollment has started. Remember, it runs October 15th through December 7th, and the dates stay the same every single year. What is open enrollment? We've got a lot of area to cover today on the show, but here's the deal. If you have questions or concerns, you're like, wow, I didn't know that. I'd like to learn more. You can always call Kevin and the team at Carolina Medicare. The number is 843-868-MEDI, 843-868-6334. And you can always go to the website, too. An easy way to get more information right out of the gate and do it quicker, if you don't want to pick up the phone, is just go to the website, carolinamedicare.com, carolinamedicare.com. Kevin, welcome. How are you? Busy, I'm sure.
Doing good, yeah, extremely busy. Now that we just started open enrollment, this is the time we're getting lots of phone calls. We're talking to a lot of our current clients, going over all the new plans, make sure they're still in the right plan, or if we need to start making changes. So as you can imagine, this is our busiest time of year. But I love doing the radio show, so I'm glad I'm here.
Yeah, you think about it. Way back in our early elementary school days, we had to learn the alphabet. Well, it comes into play when we hit 65 because now we need to know the letters and what do they mean when it comes to Medicare, right? There's Part A, B, and then there goes through a whole bunch of different letters. Let's talk the basics of Medicare. And I don't know, I guess you could say dumb it down a little bit, but really a lot of people just have never thought about Medicare because they haven't gotten to that point. When you get to 64 and you're like, holy cow, in a year I'm eligible for Medicare, there's a lot going on here. So let's kind of make it a little bit simpler for folks, Kevin. There's Part A, Part B, there's Part C, there's D, and then there's a whole bunch of other letters that are the supplements and all of that. What's the difference between Part A and Part B?
Well, that's a good question. So, Part A and Part B are what you call the original Medicare. So if you ever hear anyone say I have the original Medicare, that's what it implies. So Part A is what I like to call the brick and mortar. That's the hospitals, the general nursing, skilled nursing facilities, hospice, in-home care kind of stuff. So those are the brick and mortar kind of stuff. And then you got Part B, which is really what we call the doctors, the vaccines, the mental health, exams, things like that you would normally go through. That's where Part B kind of takes place. So there's a lot of confusion on, do I need Part A? Do I need Part B? And you got to understand what each letter really means. And so, when people are starting to evaluate all this stuff, trying to figure out if they need a Part A, a Part B, they've got to fully understand things. And you can go through this whole big book and read it and try to get the gist of what do I need or what do I don't need. But really what it comes down to is really talking to a professional to really get the better understanding and making sure you're making the right decisions so you don't get penalized if you were supposed to take it and things like that. So it's important to kind of make the right decisions day one.
So you think about it, Part A, hospitals, basically. Part B, doctors. I mean, that's an easy way to think about it. There's other parts in it, as you mentioned. But Part A basically costs nothing. That's something we have to sign up for, even if we're still working. You sign up for Part A so you're in a better position when you actually start using Medicare, I suppose, because you're on your work health care. But Part B is what we do pay for. Is that right? And what do we generally pay for Part B?
So it's a good question. So when it comes to Part A and Part B, so just to kind of back up, so Part A is free as long as you have paid into this, the Medicare system for at least 10 years or longer. Then that would be free to you. Then there's Part B. Well, Part B going into 2021 right now, the premium's $148.50, and it goes up based on your income. So a big misunderstanding is if you do make a good amount of money and you're currently working and you decide to get Part A and Part B, you got to be conscious of this. And not only that, it's a 2-year look-back period, meaning that for 2021, they're going to be looking at your 2019 tax returns to figure out what your income is, and that could end up bumping that 148 up quite a bit more for the new year and stuff like that. So you got to be conscious of what that cost is and what your income is, and get a better understanding of what that's going to cost you going forward.
All right, so Part B, it depends on what your basically income was 2 years before you get on to Part B. that is kind of interesting because I guess the key is at 63, don't make any money. Then you're good for Medicare Part B as far as the price goes. How does a deductible work, though, with Part A and Part B?
So Part A, for 2020, for example, it was $1,408 of what they call coinsurance for each benefit period. And that covers you for 1 day to 60 days, say, within a hospital. And then from the 61st day to the 90th day, you would pay $0. And then after 90 days, so 91 days and beyond, you'd be paying $704 a day for that stuff. And then with Part B, you have a $198 deductible in 2020. And then from that point on, you pay a 20% coinsurance, meaning if that bill is $100, you're paying $20 for it. And that's going to go on forever. It doesn't exactly stop at some point. So that coinsurance is always in place. And so that's how Part A and Part B work as far as deductibles and coinsurance.
Okay. All right. So here's the deal. You don't pay Kevin for his guidance. The insurance companies do. Kevin is independent, meaning he's not answering to a board of directors or an insurance company. He's looking out for your best interest and searching for the best fit for your situation, especially if you're confused. This is a great opportunity to go talk to the people who actually work in the Medicare world. Kevin Geiger of Carolina Medicare. All you have to do is pick up the phone. There's no cost for this. And then Kevin can figure out if he can help you. It's 843-868-MEDI, 843-868-6334. And why wouldn't you? This can get really confusing, and you can make a decision, actually, that could cost you more money than it actually should. Why wouldn't you get some help? If you got questions, you got concerns, again, the number for Kevin Geiger of Carolina Medicare, 843-868-MEDI. That's 843-868-6334. I'm Mark Kelly. Glad you're with us today for Medicare Made Simple with Kevin Geiger of Carolina Medicare. And we're talking about kind of Part A and Part B and all of that. So Part A and Part B, as Kevin said, run by the federal government. Part A, hospitals. Part B, doctors. Then you go to Part C, which is Medicare Advantage. So what is the difference, Kevin, between original Medicare and Medicare Advantage?
Well, I'm glad you asked that too, because let's face it, we're now moving through the alphabet, right? We've gone through A, B, now we're on to C. So we're almost there. But anyways, original Medicare, obviously we talked about it. You got your Part A, Part B, and Part B, obviously you're paying a monthly premium. When it comes to Medicare Advantage, they basically have a lot of the same features inside of what the original Medicare is, but then they have more bells and whistles. They throw different things in there that are going to give more coverage. But let's kind of go through a little of the differences between them, because there is a misunderstanding, and people do think that Medicare Advantage is exactly the same as Medicare, or original Medicare, but with some extra stuff. But there's a few little quirks to it, and I think it's important that people, get that better understanding of all that stuff. So when it comes to doctors, for example, original Medicare will cover any doctor or hospital that takes Medicare, right? That's a big deal. Now, with Medicare Advantage, you got to be careful about that stuff, because in those plans are HMOs and PPOs, and there's certain doctors that are within network and not in network, and that could tend to cost you a few bucks more, so you got to be conscious of that stuff. Same thing with the coinsurance, right? We were talking about, Part B covering up to 80%, and you're stuck with paying the other 20%. Well, Medicare Advantage, it could vary differently. I would say Medicare Advantage is very similar to our normal health insurance we have when we are working, right? You have deductibles and things like that you have to reach. And by doing that, you might save money in one area, but it could cost you a little more on the other side. So you've got to be conscious of that kind of stuff to make sure you're making the right decisions. And as far as original Medicare, it covers all the Medicare necessities that you need and supplies. With Medicare Advantage, these plans cover all the Medicare necessities and services the original Medicare cover. But again, they do have extra benefits, and a lot of them have drug plans, whereas on the original side, you'd have to apply for a different type of drug plan itself. So a couple things that are kind of, I call it quirks inside there. And, we were talking about this earlier before we started the show. There was, just yesterday, I was actually at the CVS pharmacy going to get my prescription refilled. And sure enough, it dawned on me that there's just not a good understanding of how these plans work between Medicare Advantage and original Medicare or Medicare supplements. And this poor lady, she was going up there, she was going to get some type of shot. I didn't hear exactly what she was getting. But the guy was trying to ring it up, and he says, well, she hands him over her Medicare Advantage card. She's like, well, here's my insurance card. And the guy's going, no, I need your original card because they're the ones that pay for it. And I'm thinking, oh, geez, I know this answer to this thing. I go, he's wrong on this. it's a Medicare Advantage, because a Medicare Advantage replaces the original Medicare. And so they were going back and forth, kind of almost bickering with each other, and she was confused. He was even more confused. Finally, he puts her Medicare Advantage card through, and sure enough, he pays for it. And it goes, wow, I didn't realize it did that. And she was the same way. She just didn't know. And I go, geez, this is the reason why we did this radio show. We really wanted to educate people, give them a better understanding of things, not overly complicate it, but give them enough information to make them dangerous out there.
All right, so then explain this, because, Kevin, original Medicare is offered by the federal government. When you get to Part C and D, D is the prescription drugs, but Part C, what we're talking about, Medicare Advantage right now, that is original Medicare, but now instead of it being federal government run, you're now going through private insurance companies. So it kind of eliminates the federal government, Part A and B, and now it's a private company, Part A, B, C?
That's exactly right. So Medicare Advantage now is offered through private insurance companies, very similar to your employer plan that you might have had before. And that's why it kind of mimics a lot of the ways your employer plan worked before. With the co-insurance, the deductibles you have to meet, your HMOs, your PPOs, and every other letter that's in the alphabet. So, it's very similar to that stuff, but what's neat about that is again, they do offer some more benefits outside of the original Medicare, and if it fits what you need, it works well. At the same time, a lot of these plans start at zero cost out of pocket. Why is that? Well, the money that was already paid into Medicare, that's paying for your Part A, and that $148.50 you're paying every month for Medicare Part B, is now being applied to this Medicare Advantage plan. And that's a misunderstanding that people don't realize. And that's where these plans start at zero and then can go up based on what your deductibles you want and things like that you need. So it's a good thing for people to understand that Medicare Advantage could be a really good fit for a lot of people. I mean, just to give you an example, 62% of people that are in Medicare are on a Medicare Advantage plan currently. On top of that, probably one of the biggest things about it is they don't do any underwriting. And if your health is not in the best shape right now, and you need a better plan because maybe you still are on an original Medicare and you need something that's going to offer some better coverage, it might be a good opportunity, especially during open enrollment, to consider getting onto a Medicare Advantage plan that can add a lot more coverage to fit your needs that you're currently in right now. So that's important for people to understand. And then on top of that, knowing that most of these plans have a Part D, your drug coverage, that's nice to know that it's all kind of built into one thing. And I think that's important for people.
Yeah, so all right, so we're talking Medicare Advantage. Our next segment, we're going to talk about Medicare supplements and compare it to Medicare Advantage. What are some of the misunderstandings that folks have about Medicare Advantage plans, Kevin?
Well, I think a lot of the things that people don't realize is, there are certain things that are in there. We were talking about it, but I didn't kind of digest into it too much. For example, knowing you can have vision or hearing or dental coverage all built into it, free meals, things of like a free gym membership, free transportation to your doctor, drug coverage, all that stuff is bundled in together into one plan. And it's just a misunderstanding. People, when they hear, I don't want a Medicare Advantage plan, but then they can't afford to go into a Medicare supplement, which we're going to talk about in the next segment, it's probably the best fit for them outside of just sticking with just the original Medicare. Knowing you have better coverage in certain areas and better features and other insurance stuff built into the plan, it might make a lot of sense for you, but you got to sit down and actually evaluate that to find out what's going to be the best fit for you.
All right, final question for you before we get into Medicare supplements and Medicare Advantage, kind of the differences there. Open enrollment, October 15th through December 7th. Those dates stay the same every single year. And that means open enrollment, if you have Medicare Advantage, this is an important time, I would think.
It is. Yeah, this is the time. I always tell people at this time of year, every insurance company is trying to get their market share out there. Knowing that 62% of the Medicare beneficiaries are on these types of plans, they're trying to gain as many beneficiaries on board with them. So they're adding more bells and whistles to it, adding new coverage. We just had a new carrier just come on board with us, which was quite interesting. Now they're allowing you to pay the same premiums for out-of-network doctors as you do with in-network, which kind of was a game changer. We just sat down with them a few weeks ago to go through this stuff. And so you're just seeing a lot of these insurance companies coming out to really do what they can. Because let's face it, 10,000 people a day are turning 65, meaning those are people that are going to be enrolling in some type of Medicare either now or in the near future. So they're doing everything they can to take as many participants, as you can call it, into their plans.
So Part A, Part B, Part C. So Medicare Advantage, how does that compare to Medicare Supplements? What about Medigap? Well, Medicare Supplements and Medigap are the same. So we're going to talk about that when we come back. But again, if you have questions, hey, it's easy to do. Just pick up the phone, call Kevin Geiger at Carolina Medicare. It's 843-868-6334. No cost, no obligation, no pressure. And again, if you'd like to find out more, you can always go to the website, carolinamedicare.com. Glad you're with us today for Medicare Made Simple with Kevin Geiger of Carolina Medicare. We're headed into Medicare Advantage versus Medicare Supplements. Stay with us. We're back right after this.
You're listening to Medicare Made Simple with Kevin Geiger. Online at carolinamedicare.com.
It's the time of year to review Medicare plans, and the Medicare plan that was right for you last year might not be right for you this year. With so many moving parts, many things can change, and last year's good provider might not be as good in 2020. Coverages, copays, prescription formularies. You need somebody you can bring your questions to. Someone independent. Someone who puts your best interests ahead of their own. Let Kevin Geiger of Carolina Medicare be that person. Kevin can help you review your options for 2020. To set up a one-on-one visit, call the office at 843-868-MEDI. That's 843-868-6334. Or sign up for one of Kevin Geiger's upcoming webinars at carolinamedicare.com. That's carolinamedicare.com. Let's get you settled into the right Medicare plan for next year before December 7th rolls around. Kevin Geiger at Carolina Medicare. Call 843-868-MEDI or visit carolinamedicare.com.
You're listening to Medicare Made Simple with Kevin Geiger. Online at carolinamedicare.com.
Welcome back to Medicare Made Simple with Kevin Geiger of Carolina Medicare. I'm Mark Elliott. You know, if you have questions, you can always give Kevin and the team a call at 843-868-MEDI, 843-868-6334. Carolina Medicare serving the Low Country, the Charleston area, Myrtle Beach, really the entire state of South Carolina. All right, Medicare is like a jigsaw puzzle. We're talking right now during open enrollment period, which is October 15th through December 7th. Before we get into Medicare Advantage versus Medicare Supplements, maybe refresh people, Kevin, a little bit on open enrollment. Who needs to be paying attention here to this open enrollment time period?
You know, when it comes to open enrollment, it's really anyone that, has a Medicare Advantage plan, a supplement plan, a drug plan for Medicare. This is the time you need to start evaluating what you currently have to make sure that either all your doctors are being covered in your Medicare Advantage plan, all your prescriptions are being covered in your drug plan, and actually, most importantly, when it comes to Medicare supplement plan, is your current plan is still cost efficient? Meaning, is there another carrier out there with the same letter, which means all the same coverage, that can do it for a lot less and save you a lot of money every year going forward? This is the time when you got to start looking at this stuff, which is why we get so many phone calls at this time of year, and this is why we're so busy with our current clients, reviewing everything they currently have to make sure it's the right fit for them.
So open enrollment, October 15th through December 7th. It's the same dates every single year. You switch from original Medicare to Medicare Advantage or vice versa. You can switch from one Medicare Advantage plan to another. You can roll in a Part D prescription drug plan for the first time, switch from one Part D to another if you're just making some changes. During this time period, you talk about underwriting from time to time on this show. This open enrollment period is underwriting is not needed. Is that right? And what is underwriting?
So when it comes to a Medicare Advantage plan, that's that Part C, there is no underwriting. So no matter how your health is right now, you could upgrade your plan per se because of your health issues going on right now. Going into January 1st, having a better plan that's going to have better coverage for you. When it comes to a supplement plan, which is all the other letters of the alphabet, as I call it in Medicare, those are the times when underwriting could affect you. So when you're looking at all this stuff, you got to have an understanding. If you're going to pick a Medicare supplement plan right after you start Medicare, you've got to make sure, and I always tell people, buy the best plan you can buy now, because later on when you want to upgrade it to a better plan, you're going to be subject to underwriting. And usually, like anything, like life insurance and anything else, the times we end up getting phone calls from clients that want to add more life insurance or do something like that is usually the day when they find out their health is deteriorating and they need better coverage and things like that. Well, it's the same thing with the Medicare supplements. So I stress to people, if you're coming up to 65 right now and you're eligible to take Medicare and you're looking on doing a supplement plan, make sure you're getting the best plan you can. Get a G plan that's going to give you the max coverage and so on. And we'll talk more about those letters shortly and what the differences are a little bit. But it's an important thing for everyone to understand.
Yeah, so underwriting is a big deal. If you have a health issue, now is your time to make some changes without that doctor's note, if you will. You got questions? It's 843-868-MEDI, which is 843-868-6334. All right, so we talked about Part A, hospitals, Part B, doctors, basically, and there's other things in there. And then Part C is Medicare Advantage, which covers Part A and B, but now you're doing it through a private company where Part A and Part B are run by the federal government. You add Medicare Advantage in there, which is Part C. Now a private company's handling all that for you. So the other part of this is people, and you said 62% of people that are on Medicare use Medicare Advantage. Well, that means the rest of them, I suppose, are using Medicare supplements?
Yeah, I would say there's still a good amount of people that are still on just Part A and Part B by itself.
Oh, they don't have the extra add-ons is what you're saying.
Exactly. Think of it as just like an extra feature on your car. You're getting that sunroof on your car. Do you really need the sunroof? Probably not, but is it nice to have? You get that nice sunlight in, and get a few rays while you're driving. It's the same thing. A supplement plan is just adding coverage on top of what you already currently have with your Part A and Part B. So it's important to understand that Medicare supplements are standardized, meaning they have to follow everything that Medicare does, and all they do is they fill the gaps. So when someone says it's a Medigap policy, they're basically saying it's filling the gaps. And we talked about that earlier, talking about the co-insurance, the 20% you've got to pay, all the deductibles you got to pay, things like that. Well, this is where the Medicare supplements will fill that gap and cover that stuff so you don't have huge out-of-pocket expenses. You might not be sick when you're 65, but you could be 70 or 75 and find out you have cancer or something terminal, and now you're seeing the doctor all the time. And this is when you can rack up your bills, destroy your retirement savings for yourself and for your spouse. Having that better coverage is going to allow you to know you have the coverage when you need it.
All right,
that's where a supplement plan kind of takes place.
Yeah, so that makes a lot of sense. So what is then the basic difference with Medicare supplements versus what we were talking about in our first segment, original Medicare and Medicare Advantage? What's the difference, I guess?
Well, so now when it comes to Medicare supplements versus Medicare Advantage and original Medicare, right, we're talking about our A and B, which is your original Medicare stuff. Then you've got the C, which C is your Medicare Advantage, which encompasses the A, B, C, and in most cases, your D drug coverage. Well, now you got the Medicare supplement plans, which allows you to still keep your Medicare A and B, but then it adds that extra added benefit depending on how much you want to pay to have 100% of the stuff being covered down to 50% of the stuff being covered. And we'll talk about those things when it comes to letters, and that's where the letters really take place in Medicare to understand what that coverage is. And that's why it's so important to get a really good grasp of how these plans work.
So this is clear as mud, Kevin. Okay, so Medicare supplements, now I'm going to add in the letter F, the letter G, K, L, M, N. I would think that people are kind of confused about all of that because all these Medicare letters mean a little different things, I suppose.
They do. So Medicare F, which if you were eligible, meaning you're allowed to take Medicare, so 65 or maybe you're 67 and you just left your job and now you're eligible, whatever the case might be. Before January 1st of this year, if you were eligible, you can still take on Plan F, which F was everything that G is, except it covered that $198 deductible. That was the only extra added benefit, and they eliminated that, and now they call it G, right? So
F is going away.
What's interesting is
what you're saying.
F still stays for people that currently have it, right? The old Obama.
You're like grandfathered
plan.
in. Yeah.
Yeah, exactly. But what we're finding is we find a lot of people that are currently in the F plan, and we're reviewing things, is a lot cheaper to move them to a G plan right now because it's cheaper than the $198 deductible that they would have to pay with Part B. So if you have it Part F right now, it might make sense to reevaluate things because you might end up saving $300 for that $198 deductible you have to pay every year. So it's something that should be considered. And so then you go down the letters, which I don't know why they didn't go, F all the way up to N and making it better, but it's kind of confusing. So now you get into K. K is where you have a 50% coverage versus 100% like G, and that goes down the line. Then you've got L, which is 75%, and then you go to M and N, which I can go into detail with that, but there's a couple nuances there. But really when it comes down to most people that we work with typically end up going with a G plan or an N plan just because it fits their need. They're buying that Medigap or Medicare supplement plan to fill the gaps. They want to make sure they have the most amount of coverage. And, at the end of the day, Medicare supplements are going to be a little more expensive. But what I like to say is that they're the Cadillac of coverage, not benefits like a Medicare Advantage plan is with all the bells and whistles they throw in there. It's all about coverage. And if you want the best coverage, then this is what you're going to end up looking at as a Medicare supplement plan. And so when it comes down to things, you just got to realize, do you want to pay more now or do you want to pay more later? And that's what I always tell people. That's what it really boils down to, is understanding what's going to make the most amount of sense for you.
And so the way to find out what makes the most sense for you, is it Medicare Advantage or is it Medicare Supplements? And remember, Medicare Supplements and Medigap, they mean the same thing. They do the same things. It's just different verbiage, I guess you could say. It's because Medicare Supplements fill the gaps. So that's what led to Medigaps. That's why you call Carolina Medicare and the team of Kevin Geiger. 843-868-MEDI is the number, 843-868-6334, because this is a jigsaw puzzle. Everybody's situation is different. Husband and wives have different plans in a lot of situations because they have different needs. Kevin can walk you through that. 843-868-6334, no cost for this. Kevin is working for you, basically, and the insurance companies will pay him because he's giving you the advice that makes sense for you, not for the insurance company. It's about you when you come in and sit down with Kevin and the team at Carolina Medicare. Again, that's 843-868-6334. A couple minutes left in this show today. We covered a lot of ground, obviously. But at the end of the day, Kevin, it really seems to come down to education, to make that educated decision on which plan, which Medicare Advantage, Medicare Supplement, what do I do? Well, that's where you come in to help them. And you have your non-for-profit Retirement Focus Academy. Could you tell us a little bit more about that as we wrap up the show today?
Absolutely. And so, as I'm sure many of you are going, wow, I didn't know half the stuff. And I probably touched on a fraction of what needs to be known about Medicare. So, again, we created the Retirement Focus Academy in order to educate people because I wanted them to feel that they can come in, be educated, not be sold on, and knowing they have professionals in the financial industry, in our industry, in Medicare, insurance, everything else to really boil down and break everything down for everyone so they have a better understanding of everything that has to do with retirement. And right now with Medicare, we're doing so many of these workshops and webinars to really kind of break everything down for them so they can feel comfortable when they are retiring or in retirement, knowing they're making the right decisions, because one bad mistake in retirement could cost the rest of their retirement for themselves. And I want to make sure that doesn't happen. So if you go to retirementfocusacademy.com, that's retirementfocusacademy.com, you'll see our list of classes and things that are coming up, and we'd love to see you there.
And this is a great resource, and as always, it's free of charge to you. So you can go to retirementfocusacademy.com. And then don't forget, you can also go to carolinamedicare.com as well to find out more about Kevin and the team. But the Retirement Focus Academy is really for education purposes, right? So you can learn more and you can go check it out. There's no cost for any of this with Carolina Medicare or the retirementfocusacademy.com. So at the end of the day, you're going, holy cow, I'm in the open enrollment period right now. It's October 15th through December 7th. Same dates every single year. I've got a little window of opportunity right now. I need to reach out to Kevin and Carolina Medicare. Do it quickly then. Pick up the phone because he's busy. 843-868-6334, but he's here to help. 843-868-MEDI. That is 843-868-6334. Do it now. Time really is of the essence when you're talking about open enrollment October 15th through December 7th. 843-868-6334. Kevin, enjoyed it. Have a great weekend. Have a great week. I know you're going to be busy. Thanks for being with us, folks, for Medicare Made Simple.
Take care, y'all.
This has been Medicare Made Simple with Kevin Geiger. To talk with Kevin, call 843-868-MEDI. That's 843-868-6334. Kevin is also online with your resource on all things Medicare. Visit carolinamedicare.com.